Hello and welcome to this information session. Thank you so much for joining us. My name is Bronwen Edwards. I'm the CEO of Roses in the Ocean, and I'm joined today by Dr. Rod McKay, who is a psychiatrist who specialises in working with older people. Rod, I'll just pass to you to introduce yourself further.
Hello all. Just to briefly say that as we talk today, I'll be wearing a few different hats that I've had during my career. One in providing advice to the Older Persons Mental Health Policy Unit, one as a former clinical director, and probably most importantly, as a clinician and old age psychiatrist, so someone used to working with older people and learning from older people.
Lovely, thanks Rod. So first of all, I'd like to acknowledge the traditional owners of the lands on wherever everyone is who's tuning in to this information session, and pay our respects to their elders, past, present and emerging. I'd also like to acknowledge people with a lived experience of suicide, be that through their own suicidal thoughts or having made an attempt on their life, or if they care for someone through suicidal crisis or have been bereaved. We acknowledge you and we thank you for the incredible value and insight that you bring to all of the work in suicide prevention. So today we're going to talk to you about a new project that is has come about because of the incredible work that's happening right across New South Wales as part of the Strategic Framework for Suicide Prevention. And Roses in the Ocean has been contracted to work with the local health districts on a number of projects, one of them being the co-design of the alternative to ED safe havens. What's become really apparent is that it's incredibly important that these safe havens and the suicide prevention outreach teams and all other suicide prevention services are really accessible and appealing and welcoming to everyone in the community. And so this project is all about creating, exploring first and really interacting with older people in New South Wales to really understand from them and the people who care for them, what are some really specific guidelines that we can provide all suicide prevention services with to ensure that services are exactly that. They're welcoming, they're appropriate. They are places and services that older people want to engage with and get the support that they need. So Rod, I'd like to really hear from you as to why, from all of your experience in this space, why is this so important?
I might start with the obvious, and the obvious is that suicide is a tragedy at all ages. And yet somehow we seem as a society somehow to see suicide in older people as different, and it doesn't always receive the attention that I and the policy unit and many others believe that it should receive. And so this is a real opportunity to actually learn more about what works for older people who are at risk of dying from suicide, and what works in terms of supporting people who are around that person. The Older Persons Mental Health Policy Unit in New South Wales is a fairly unique being, in that it actually is a small group of people whose focus is on how do we improve the mental health of older people. And there isn't anything else like that in Australia. So this is a unique opportunity to actually have a say that can have an influence that clearly in New South Wales, but then hopefully there's opportunities for that to be a broader influence as well. The Zero suicide is a real opportunity to have the aspiration for no one to die from suicide who is in healthcare. What we know is that older people access healthcare in different ways to younger people. What we don't know all the answers to is how we can use that to actually help them avoid dying from suicide. The Gold Coast has done great work looking at zero suicide, and they've published some of their outcomes. But one of the disappointing things there is the fact that only a very small proportion of older people actually access their pathways to help. And that, unfortunately, is consistent with other efforts internationally to reduce suicide from older people. But there have been successes. The UK has reduced deaths from suicide from older people, so we know it can be done. We need to learn how that can be done in Australia. And that's really where we need your help. The policy unit does a number of things, and with each of its activities, it's been on a journey of increasing the involvement of older people in whether it be policy development, whether it be benchmarking, where we compare how services are working together and learn from each other about how to work better. And what we would like to see with this work is to see this as again a way of us reaching more into the wisdom of older people and those around them to help us to learn how to work better with older people and reduce deaths from suicide. We know from work that's happened with talking about what does peer work mean for older people, that it doesn't mean the same thing in terms of what older people see as a peer as it does for younger people. A peer is someone they can relate to as someone who's been through the same thing as they have. So illness or experience of suicide or risk of suicide may be one of those things, but age is really important as well. And so what does that mean as an older person who's trying to access help? What does that mean for a space that is supposed to be a space that they feel comfortable in, a space they want to go to seek help from? Are things that we need your input to help us understand those things. Then we need to understand what is it about the way that clinicians interact with the older person that again makes them feel safe to take the next step. What is it about the way they access help before they may get to mental health services or after they leave mental health services? That means that that transition works. It works for the team around the person who should be there to help them. It works for the family. It works for that person who's at risk of suicide. We can make guesses at that. We can make more than guesses. We can work off evidence around some of that, but that evidence often doesn't have the voice of older people. That's the voice we want from you.
Thank you, Rod. That's a really terrific summary of the importance of the work that's going to happen early next year, and I think the impact, how that can actually translate to grassroots service delivery straight away. So in terms of the logistics of how this project's going to work, early in the new year, we're actually going to be looking for people from that older population who have experienced their own suicidality and the people around them, as you say, Rod, that support them. We're going to be establishing a lived experience advisory group of older people, and we'll provide some training for those people. Firstly, we'll provide some training on how to use some of the technology, so we'll support you to do that, and then we'll provide some training for you, and that particular training will be online. And the reason for that is that we're really very focused on having older people right across New South Wales. It's really important that we get really good diversity of different types of lived experience, demographics, geographical locations, so that it can be really representative of a statewide project. And then we are going to hold small focus group conversations. We'll engage other stakeholders, other people who are interacting with older people, providing support to them in some way. And then we will be actually coming into community, and we'll run a number of face-to-face consultations. So there'll be a number of ways for people to get involved in this project. For those who are really keen to be part of a lived experience advisory group, that's going to be one option. When we move to the co-design phase, there will be some online opportunity, and then there'll be in-community opportunity to come together and contribute your insights, your ideas to this process. And then with all of that information, from that will come some guidelines to help services right across suicide prevention to better engage and support older people. So it's a process that will take 2 or 3 months, and we will be disseminating information right throughout New South Wales through the local health districts, through social media. We'll make sure that there's printed material available to circulate in community, and we're really hoping that as many people as possible can become involved. There's also going to be online webinars summarising the conversations and the work that is in progress, and there'll be open surveys to anyone in the community to contribute. So there's multiple ways to get involved. We really hope that, that if you're interested, that you'll get in touch with us as soon as that information starts to be spread out through community, and we really look forward to working with you all. Rod, is there anything final that you'd like to say today?
I think the final things I'd say is you may not think you're the person to come forward, but it doesn't mean you're not. You may be surprised. But the other is you may know somebody, and I'd really encourage that if you think you know somebody who might be that person to come forward, or if you're a clinician who's watching this, or a service manager, and you think you may know somebody, think about reaching out to them as well, because really, we really need that range of inputs, and it really will make a difference.
Yeah, thanks, Rod. Absolutely, and so important that we have their views as well in terms of, as they're supporting people, what are their insights, and what can we learn from all the people who are trying to help the older people in our communities. So thank you so much. Thank you for listening.